Afya yetu jukumu letu, ndio ndio. Afya yetu jukumu letu, ndio ndio. Afya yetu jukumu letu, ndio ndio.
Afya yetu jukumu letu,
ndio ndio.
Afya yetu jukumu letu.
Health is wealth, and the government invests substantially in the provision of health services. Good quality lives depend on community behavior norms that promote health and prevent diseases. The involvement of the community in matters pertaining to the people's health is an important component in the reduction of the disease burden. Prior to the introduction of the community health framework, morbidity and mortality rates, especially among the children, remained high. The evolution of community health services in Kenya dates back to early 1970s, where it was known as Community-Based Healthcare (CBHC) in Kakamega, and has remained the beckoning impetus for its growth and development to date. Amazingly, Professor Miriam Were, the current Moi University Chancellor and Goodwill Ambassador for Community Health Strategy, initiated a community-based healthcare program in Kakamega in 1975.
By 1976, I had formulated what we called the community-based healthcare approach. I wanted to have a system where we work with the people in the community and leave them there to continue to improve their health, to continue to prevent disease, to continue to promote health. And I carried out that project between 1976 to 1982. And it was actually designated as the National Pilot Project for Community-Based Healthcare by the Ministry of Health. It just happened that at the same time in 1978, there was going to be a major conference in Alma-Ata in the former USSR on primary health care. And since my project was the only project that had data and experiences on community health, I wrote the paper for the government of Kenya to present at Alma-Ata.
Cancer, high pressure, diabetes, TB, HIV kwa shako, ETCC rogi, warning, zikitumaliza nani atabaki kujenga inchi, lifestyle hi-fi, full tank ya kerosene, kwa engine ya gari, juu iko kwa menu, si lazima uweke inyu, hata uombewe na pop, hauna hope, hautapitia spaghetti.
The Kenya Demographic Health Survey, KDHS 2003, revealed worsening indicators of infant and maternal mortality rates. The need to reverse the worsening trends called for a different way of doing things, forcing a paradigm shift from curative to preventive and promotive approaches.
It is at this time that we try to find out what exactly can we do with the money that was available. And the people I consulted were Professor Miriam Were and Professor Dan Kaseje. In the consultation of both, we came to the conclusion that it is time that we tried a community health approach as a principle on investing more in public health.
In this regard, the government launched Community Strategy in 2006 as integral part of National Health Sector Strategic Plan 2, NHSSP2, 2005 to 2010, with community participation at the center of CHS managed directly under the Health Policy Secretariat in the Ministry of Health. Today, the Community Health Strategy, CHS, has evolved into community health services and is recognized as the foundation of the health system. Vision of community health services states that healthy people living healthy and good quality lives in robust and vibrant communities that make up a healthy and vibrant nation. The mission is community health approach to become the modality for social transformation for development from the community level by establishing equitable, effective and efficient community health services in community health units all over Kenya. It is an approach by the health sector in Kenya through which communities participate in their own healthcare and development, as summarized in the CHS slogan that reads, "Our health, our responsibility. Afya yetu, jukumu letu." Under the community health strategy, health services are delivered through a community health unit with a given population of 5,000 people in about 1,000 households. In most cases, a CHU is about the size of a sub-location. CHS implementation guidelines and training materials for community health workers (CHWs) and community health extension workers (CHEWs) were developed in 2007. In support of this noble cause, Ministry of Health established a division to manage the CHS at the policy level in 2008, then headed by Dr. John Odondi.
As we start to think through how we are going to implement the community strategy, it became important that we form governance structures.
We formed a technical working group which under responsibility of providing policy direction in terms of community health strategy matters. But later on, in 2010, it was converted into now an ICC. And these ICCs were formed from all partners that are interested in working at level 1 at the community, and then the Ministry of Health.
Through this committee, actually, we managed to mobilize adequate resources. I think we got to establish units from 0 to 2,551. The cost of developing one unit is very high. To develop 2,551 within a span of 4 years, to me that was a very tall achievement.
One of the biggest first milestone was we organized first national conventions where we invited, I think, almost 200 people from Kenya, all the communities, at that time 8 provinces, as well as also we invited a few countries outside of Kenya to share lessons learned, best practice, even challenges.
Partners have been instrumental in the provision of technical and financial support towards the development of the CHS standards, CHS community strategy, M&E plan, revision of community health information system tools, and the community health strategy documents, as well as production of training manuals for CHVs and CHAs. These documents have been developed through workshops and pre-testing at community settings.
The partners concentrated very much training the workforce now, the community health workers and the community health extension workers. That was not a small effort, it was a lot of resources which were used.
An evaluation exercise conducted in 2010 since the CHS was initiated showed a significant improvement in community health indicators.
I've been working in different African countries and Asian countries, and I've seen big impacts when communities are involved. And then I also believe that a solution is within us.
Our organization is about child's rights. So we endeavor to see that every child is born healthy, every child survives, every child thrives, and develops to reach their full potential. To be able to prevent many of the deaths that are occurring for the under 5s, for the mothers also, we are implementing community health services to implement community level high impact interventions for the mother, the newborn, and the child. Secondly, we look at continuum of care. For us to achieve continuum of care, we see the community level as one of our critical components in supporting the service delivery in health services like we are doing. Another reason is that we have disparities in access of healthcare services in Kenya. So you find, especially in the arid areas, people travel over 50 kilometers to reach a health facility. So in order to bridge that gap of access to health facilities, community health services is a strategy that helps us be able to reach people at the household level, especially where there is poor access to health service delivery, the static health facilities. The other reason is that we see communities as partners in the provision of health care. And we appreciate that they are also duty bearers. If the child is to survive, then the community has to participate in a meaningful way. So we look at engaging community in a meaningful way to empower them to take charge of their own health. So those are the 4 main reasons why, as UNICEF, we are supporting the investment in community health services.
We recognize, as Government of Kenya also does, that community services are very important as a link from the lower levels to higher level service delivery. And if you look at the continuum of care, people mainly start prevention and promotion of health services at the community level before they go to be linked to the hospital. And then after hospital, when they are discharged back to the community.
When we started the community strategy, the sanitation coverage we were at 83. Right now, it is a reading in sanitation at 98%. So I am associating that one with the community strategy. The community health workers being the workforce at the community level, identifying the household without sanitary facilities, more specific the toilets, putting much of the emphasis, and at the wrong end, having the product, the output is the toilet.
What's more, such services are dispensed in a familiar, friendlier manner, the challenges encountered in the process notwithstanding.
Community health strategy has really helped us in terms of improving health indicators in the county, especially in the area to do with skilled delivery, delivered by skilled birth attendants, and also in the area in nutrition, because we have been making use of CHWs in our facilities in terms of taking weights and other providing other nutritional services in our facilities, and also in referral. At least we are seeing more mothers coming for ANC services.
Policymakers are now working together with the communities to produce different evidence, all the different kinds of evidence in community health services. And now we have 3 sites, nomadic, urban, rural, because people realize that Kenya is so diverse. We cannot talk about one example, and we need to really be very inclusive of all when it comes to the implementation of this strategy.
The greatest achievement which I can say is actually the production of this document you can see over here. This is not just a document, but what I'm saying is the achievement of getting a kanda that is specifically working at level 1 under the name of Community Health Service Personnel.
The biggest lesson, of course, is that most people who are in the policy aspect do not understand, and that's why they don't give money.
As it is now, community health services is an administrative structure that is based on policy, more on policy than a legal framework.
Community health service is actually about empowering the individuals and the communities and the household to take care of their health. Devolution is doing exactly this. We have now taken the power, the resources, the decision making and the implementation process and active or constructive engagement of the community to the grassroots level. So for me, devolution actually is an answering the community empowerment.
The more attention the counties will pay on the future, on their community health services, the healthier their people will see. They will see that their people become, the people in the counties will become very healthy. They will see that the disease expenditure on health will begin to go down because people are healthy and there is not much expenditure on diseases. They will see that now children are growing in a healthy way, mothers are not dying, and we also, as part of the community health services, family planning becomes more common and more prominent all over Kenya. because we know that when a mother has children very close together, her health is affected. She cannot be very healthy.
This year we want to form 6 units, and it's within the budget for this financial year. So the support is there. The problem are the resources, which are not enough. So we spend more money in curing, because you can't stop curing people and say, let's go and prevent, right? It has to be progressive.
The future, at least now with the support of the county, the devolved unit, at least we have money within the county we can be able to budget and make use of the resources. So there's a lot of light in the tunnel. What we need is also the stakeholders to come. What I can say, we are not very lucky as a county in terms of stakeholders funding community health services, because I think due to insecurity, but we urge the stakeholders and other donors to come on board so that we can achieve our objective of improving community health services in the county.
First things I think the government should really focus on is really to do a big sensitization to the county, advocacy sensitization, actually to share lessons learned and best practice impacts, positive impacts of community health services. It works. So that county government can put or secure budget to implement community health services.
I see community health services here to stay because it's part of our health sector service delivery, and it's one of the critical levels that if we fully invest in, then we are able to achieve the health outcomes we all endeavor to achieve, and we are able to reach our goals as a nation.
The future of CHS is bright, it's brilliant. Especially with the devolution of services to the community level, because now we'll see more and more interventions at that level coming out, and more resources, especially at the county level, coming out to support the health services. And this, I would say, is a bright future to me. Is a future that everybody would be proud of when you look at these interventions at the community health services.
The Kenya Essential Package for Health in the Health Sector Strategic and Investment Plan 2013 to 2017/18 defines health services and interventions to be provided at the various levels of care, ranging from the community, sub-county or primary care, county and national level. In all this, success depends on the combined efforts of all concerned, that is, the government, development partners and other stakeholders who include health workers, community health volunteers, and community members. Overall, community participation holds the key to creating a resounding impact in the health sector.
Afya yetu, afya yetu, jukumu letu. Afya yetu, afya yetu, afya yetu, afya yetu, afya yetu, afya yetu, jukumu letu.